The AAPI is a forum to facilitate and enable Indian American physicians to excel in patient care, teaching and research, and to pursue their aspirations in professional and community affairs. From its humble beginnings 32 years ago, today AAPI, the American Association of Indians in America, is one of the largest diverse professional physician associations in the world. AAPI represents the interests of more than 100,000 physicians, residents, fellows and medical students of Indian origin in the United States. AAPI is making significant strides and progress through 3 decades of hard work, commitment and passion of its founding fathers, leaders and members making significant contributions that have made AAPI one of the strongest diverse physician associations in America. AAPI continues to live its vision of placing the patients first. It has lobbied hard for physicians' rights, supporting the communities that need help and giving back to the former homeland. AAPI's success this year under dynamic presidency of Dr. Jayesh Shah is the story of the hard work of each and every AAPI member who has selflessly set out to create a better AAPI for future generations. AAPI started with 9 city childhood obesity awareness fundraising drive all across the United States. Since then, AAPI has undertaken the challenge to bring about awareness of childhood obesity through a program called Adopt a School Childhood Obesity Awareness Campaign by doing school walkathons and educating the students, teachers and parents on how to fight this national and global epidemic. This is the first time that National AAPI is working directly with the community and schools for health promotion and disease prevention, with a goal to adopt at least 100 schools in 2013-2014 in as many states in USA as possible. AAPI has developed Strategic Vision 2020 plan. With the help of AAPI's honorary advisor Anwar Feroz. AAPI USA had an extremely successful 8th Global Summit in Ahmedabad, Gujarat from January 2nd to 4th, 2014. During the summit, Mr. Narendra Modi, the then Chief Minister of the state and the present Prime Minister of India, said that we must give importance to innovation. He recalled that earlier in the villages, one Vaid would be enough to cure every disease, but now that is changing. He pointed towards the increased role of technology in the health sector and observed that medical science is dependent on technology in a very big way. He had even talked about focusing on health assurance instead of health insurance. He also added that emphasis must be given towards preventive healthcare in addition to healthcare, and that Lok Shikshan can play a major role in this. He opined that the poor people are the worst sufferers during the time of poor health. Sri Modi recalled a statement made by the Honorable President of India that so many families are impoverished when one person falls ill, and added that this should not happen. Dr. Harshvardhan, the present Health Minister of India, had also attended the event as a chief guest and had received the Excellence in Leadership Award. The global summit was also attended by Dr. Abdul Kalam, the erstwhile President of India. Another hallmark of this year is the historic partnership between AAPI and AHA, the American Heart Association, aimed to decrease mortality secondary to heart attacks and stroke in India, and to implement Saving a Child's Life program. During the Global Summit, AHA Vice President John Mayners attended the event and promised AAPI for long-term partnership. AAPI conducted the first workshop and ACLS and BLS at the Global Summit. Another highlight was the AAPI and American College of Physicians partnership to bring about the best education program in India and USA. This year, the AAPI had their first Young Physician Conference at Miami, Florida, which laid the foundation for next generation of young physicians to get involved in AAPI. With the help of young physicians, AAPI was put on all social media. 2 legislative days were conducted to work on issues which are close to individual physician practice in USA, like the SGR appeal, and issues which are close to Indian physicians, like the immigration reform, which attracted more than 40 senators and congressmen to AAPI's legislative conference. AAPI implemented several new novel ideas to bring our alumni and specialty convention to the AAPI annual convention. AAPI is organizing the first Be Fit, Be Cool walk during the AAPI convention. For AAPI, 2013-2014 was year of people, pride, passion, and promise of the future.